San Diego 6 News in the morning. Your station for balanced news.
Good morning and welcome to San Diego 6 on this first day of summer. I'm Courtney Dwyer.
And I'm Alex Michelson. It is Sunday, June 21st. Happy Father's Day to all the dads out there. Hopefully you're enjoying the celebrating this morning. And in addition to being Father's Day, it's the first day of summer, as Courtney said. One thing so many people on so many people's minds is how to get tan for the summer. An SDSU study shows that here in San Diego there are more tanning salons than Starbucks or McDonald's. That's pretty unbelievable.
Which doesn't make sense, yeah.
Yeah, so how do you tan safely this summer? A doctor from Alvarado Hospital will be along with some suggestions.
I know suggestions that I don't know if we do want to hear them, but he's going to also tell us that no tan is a good tan, I'm sure. But we'll let him answer the question. So we hear this so much living here in Southern California. We all know a tan is not great for your skin, and a sunburn is definitely a bad thing, but still we continue to seek that summer glow, especially in the summertime. Dr. Barry Handler is a plastic surgeon at Alvarado Hospital, and this morning we're talking about the safest way to tan. Except, doctor, I know what you're going to tell me first and foremost. There is no safe way to tan, right?
Well, basically, yeah. There are a few spray-on tans that are kind of a chemical fake tan, and those are pretty safe, but pretty much everything else involves exposure to UV light, which is damaging to the skin.
Okay, let's go to UVA, UVB, the differences here, because there is some confusion and what's worse, you know. So can you kind of explain the difference between the two? We see now most of the time on sunscreens it's UVA and UVB protection. What's the difference between the two, though, and what should we know about them? Well,
within the ultraviolet range of radiation, there's three different types, A, B, and C. C you can forget about because it's filtered out by the atmosphere, but they're different wavelengths. UVB is the one that is commonly associated with causing sunburns, and UVA penetrates deeper and is less likely associated with sunburn.
Okay, so when we go to these tanning salons, oftentimes they'll tell you, oh, this is a much safer way to do it than tanning out at the beach. What's your opinion on that? Is that true?
Well, there's a big battle between the medical industry and the indoor tanning industry, and you've got to realize that for the indoor tanning industry, this is a $2 billion a year business in the United States. Their two main points are, one, it causes production of vitamin D, which is healthy, and two, that it creates a tan which is protective, and both of those things I think are false. If you're fortunate enough to be born with darker skin, we do see that darker skinned people have less skin cancers, and the melanin is protective. But if you have to radiate your skin in order to get it darker to protect it, you're damaging it, creating that tan. So that, and the vitamin D argument, that doesn't hold water either. Studies have shown you need about 10 minutes of sun exposure twice a week to get all the vitamin D that you need.
So this is your opinion based on some studies that have taken place, I take it then?
Well, this is reading all the literature and looking at both sides. The tanning industry really takes the medical facts and kind of twists them around to support their contention. But in point of fact, the evidence really shows that people who use tanning beds have higher incidence of melanoma, they have higher incidence of squamous cell skin cancer, basal cell skin cancer. This is not just US studies, these are studies from Sweden, Australia, around the world, and they're over 10, 20 years. Okay,
so best way, obviously, in your opinion, maybe to use those lotions that we can buy possibly at the drugstore that maybe give you that, you know, gives you that sunless tan, I guess you could say. I want to talk to you a little bit about, you know, the skin cancer increasing each year. Why is that happening if so many more people seem to be understanding the importance of protecting your skin?
Well, I think that we're exposing ourselves to sun more frequently now, and the population is increasing, and we're more aware of it. So we're diagnosing it earlier.
Okay, well that's always good news. All right, Dr. Barry Handler, thank you so much for being here. Some good advice. We appreciate your time this morning.
Thank you.
All right, and of course for more information, just go to san diego6.com and click on Hot Topics.